I want to get to the political attacks. You have become, you've been sort of become a caricature on the right. There's some really wild, fantastical conspiracies. I got to play one because it's a sitting United States senator, Marsha Blackburn. I think we have a sound of this. Let's play that one.
Here are some facts that I want you to know. First of all, yes, Dr. Fauci was emailing with Mark Zuckerberg from Facebook, trying to create that narrative, cherry-picking information so that you would only know what they wanted to know, you to know, and there would be a narrative that would fit with this cherry-picked information.
I don't even know where to begin, but it's a sitting United States senator. It's the most, what I would call the most extreme version of what I've heard. You've got Kevin McCarthy doing his own version of this, Marco Rubio. You're aware of the critiques. You've been debunking this. How do you debunk something like that? She's got it in her own head. Again, a United States senator that represents the state of Tennessee. What do you say to that?
You know, Chuck, I don't have a clue of what she just said. I don't have a clue of what she's talking about.
Neither did we.
I mean, welcome to the club. I have no idea what she's talking about. And I'm sorry, I don't want to be pejorative against a United States senator, but I have no idea what she's talking about. And, you know, Chuck, if you go through each and every one of the points, which are so ridiculous as you know, just painfully ridiculous. But nonetheless, if you go through each and every one of them, you can explain and debunk it immediately. I mean, every single one. He should be fired because he, in the beginning, changed his mind about masks. Well, okay, so let's go back early on with the masks, and let's take a look at that. At the time that we were saying we shouldn't be wearing a mask, there were three factors that were going on. A, there was thought to be a shortage of masks. B, there was no evidence that masks worked outside of the context of a hospital. I wear a mask when I'm seeing patients with respiratory disease that could be transmissible, like tuberculosis, a well-fitted N95. Thirdly, we were not aware of the extent of asymptomatic spread. So we said you don't really need to wear a mask. It wasn't only me. I'm picked out as the villain. It was the Surgeon General of the United States, and the entire CDC was saying the same thing. So as we went from January, February, March, April, it became clear that those three things, A, there was no shortage and you could wear a cloth mask. B, the data showed that, in fact, outside of the hospital setting, masks do work. And third, to our painful awareness, it became clear that 50% or more of the transmissions were with people who had no symptoms. So that's when we said, we've got to get people to wear masks. That's what's called, Chuck, the scientific process. You make a recommendation, an opinion, and a guideline based on what you know at a given time. As a scientist, as a health official, when those data change, when you get more information, it's essential that you change your position because you've got to be guided by the science and the current data. That issue with masks is people want to fire me or put me in jail for what I've done, namely follow the science. I could go the next half an hour going through each and every point that they make. It's preposterous, Chuck, totally preposterous.
Well, and I want to end with this. This is an email you sent on February 27th. You happen to send it to Morgan Fairchild. And I just want to end with it because it only underscores the fact that you've been extraordinarily consistent. And I'll just read the last part here. The American public should be prepared to mitigate an outbreak in this country by measures that include social distancing, teleworking, temporary closures of schools, et cetera. You wrote this on February 27th. This is, I believe, we were still a month away from 15 days to slow the spread, all of those things. So there was a ton of consistency throughout these emails. So we've struggled to understand why there's controversy around it. But I want to end with this question. You are now getting attacked. As you know, many state public health officials have quit their jobs over the last year because of the unrelenting attacks that have taken place. And now you're at the focal point. What is your level of concern that we're going to discredit public health officials to the point of, look at Russia. They actually have a good vaccine, and none of their citizens will take it because they don't trust their own government.
Right. It's very dangerous, Chuck, because a lot of what you're seeing as attacks on me, quite frankly, are attacks on science. Because all of the things that I have spoken about consistently from the very beginning have been fundamentally based on science. Sometimes those things were inconvenient truths for people, and there was pushback against me. So if you are trying to, get at me as a public health official and a scientist, you're really attacking not only Dr. Anthony Fauci, you're attacking science. And anybody that looks at what's going on clearly sees that. You have to be asleep not to see that. That is what's going on. Science and the truth are being attacked.